the COVID-19 pandemic. This forum is part of the Sunday evening lecture series organized by Dharma Master Yong at CDDB. I'm Raymond Ye, a moderator for this series of lectures in the forum. Two highly respected physicians in our community. The title of this evening's talk and discussion is The Big and Local Pictures of COVID-19. Dr. Trotter will open with some reflections, and I will follow up with some questions to begin the conversation. If people in the audience have questions, please send them over and our technical team will forward them to me so that I can post the question to continue this discussion. So let me first make a brief introduction to our speaker and translator. Dr. Marvin Trotter is a medical doctor with more than 41 years of diverse experiences, especially in the internal medicine. He was the former chief medical officer at Adventist Health, Ukiah Valley. He was a graduate from the University of Texas Southwestern Medical School at Dallas, where I taught at UT Austin for 10 years. So, Dr. Henbing Wang is an outstanding, highly respected hematology and oncology specialist associated with the Adventist Health, Ukiah Valley. He was a graduate from the medical school of the University of Minnesota. So Dr. Trotter, will you begin your introductory remarks this evening?
For me?
Yeah.
Okay. Thank you for having me. I hope to give a picture of the US and local conditions about COVID. Should I continue in English?
Yeah, because Dr. Wang is translating simultaneously.
But I can't hear him.
Or
Okay.
you cannot hear, right?
Okay, great.
You
Okay.
don't want. Yeah.
The US has some 200,000 cases a day now in the US, with about 2,000 people a day dying. Fortunately, California is doing much better and is only having 10,000 cases a day. Yesterday, we had 27 people in Mendocino County. I'm going to hold you up a picture because sometimes a picture gives you a much better idea of what's happening in the US than I can speak to.
Wow.
As you can see, California has almost no dots.
That's
But parts of America look like ink has been spilled on the map. There's so many cases. The state with the highest number of cases right now is North Dakota, with only 750,000 population. So where it used to be a West Coast and Northeast problem, it is now much more of a Midwest South problem. Locally, things were worse here a month ago, and then are now increasing. A month ago, our emergency room and ICU were very typical of Northern California. Our ICU a month ago had 4 patients on ventilators. All 4 of them were Hispanic and diabetic, 2 of the biggest risk factors for COVID. The hospital now has taken our old ICU and made it into only COVID patients, which makes it much better for the hospital, but hard on the doctors and nurses. I spoke with an ICU doctor and an ICU nurse tonight. The doctor said it's quite scary. He is an older physician, as 2 or 3 of the ICU doctors are, and have the young resident physicians actually see the patients, while they go in the room very rarely. But they say it's a very difficult disease, and I'll try to explain that. He says that Dr. Chetlin and Dr. Newkirk, who I spoke with, say that the problem is that it's not just an influenza, that it's a vasculitis, an inflammation of the arteries and vasculature of your body. The most common thing people talk about are pulmonary problems called adult respiratory distress syndrome, ARDS. And essentially what that means is that the capillaries leak around your air sacs. And because of that, water goes into your air sacs. And if your air sacs are wet, you can't exchange oxygen, and that's why you become so hypoxic. That's very common in H1N1 flu. But on top of this, the patients have strokes, heart attacks, pulmonary blood clots to their lungs, pulmonary embolism. They also have what's called brain fog. 1 out of every 3 patients admitted to the hospital lose about 10 years of their neurological capacity. So they have problems with dementia or returning to their jobs. Another problem is kidney disease and some gastrointestinal problems. But they're very difficult patients to treat. And I'll try to tell you specifically what they have to do with the ventilator, which is very unusual. Dr. Chetlin and I have seen many, many ICU patients. I've worked in the ICU in the emergency room. But the ventilator has to be put on a duopap mode, which is very unusual. If everyone will take half of a breath and now pant at 30 to 40 times a minute, that is what the ventilator is trying to do. With half the breath, it forces the fluid out of your air sacs, and then the panting allows you to exchange oxygen and CO2. Am I going too fast?
No, you're fine, I think.
Okay. So they're complicated medical patients. Number 2, the patients themselves are very isolated. They get no visitors. They see the physician and nurse as little as possible to decrease their exposure in spite of everyone being hooded and gowned and having internal respirators. I think that's very disorienting if you're a patient scared you're going to die in an emergency room, I mean, in an ICU bed where you rarely see anybody. The nurse I spoke with on the phone tonight, Krista Lord, said that it's very hard not to be burned out by being a nurse. The reason is they're limiting the number of nurses that work in the ICU, especially if you speak Spanish. They keep you there as much as possible. So the nurses that do work, every shift they work is in the ICU. She says it's very hard. She wishes she could quit, but she understands that she should keep going. She also draws the blood on the patient. She washes the patient. She changes the bedding on the patient, all to keep other people out of risk. She writes her name on the forehead of her mask so the patient will know who she's talking to. She says it's okay when they're not too sick, but last month when we had 4 people on a ventilator, all Hispanic diabetics, 3 of them died, and the 32-year-old was sent to a long-term facility with a tracheostomy. Hopefully she'll do well. So I'm going to stop there, and perhaps people would like to ask questions. The ethics committee has yet to be called to decide who or who not could get a ventilator. We've had enough equipment that hasn't had an issue. And I'll end on one other aspect. The suicide rate and overdose rate in the United States has increased some 30% during this year because of the isolation, I think, and the loss of community during the COVID exposure. Is that enough opening remarks?
Oh, that's yeah, one pretty scary. I want to follow up with the question that in terms of you talk about ethics.
I talk about what?
Ethics, right?
Yes.
I mean, I can see that in such a hard time that there are several things take into consideration, right? I mean, I can ask you the question that you talk about ventilator, right? We don't have problem here, but I'm sure in rural hospitals like Dakotas now, there's going to be a problem, all right? So who gets the ventilator, who doesn't? Or, for example, you have, say, a homeless that in the hospital. Now that, do you release him back into the street that he might have many other conditions after this, right? So I think ethics, I mean, medical, health care professionals have always on ethical behavior, but in those conditions, how do you handle it? Who has the right?
Yeah, the ethics committee makes that decision. My concern, much like El Paso, Texas, has added 600 beds to their hospitals and are helicoptering out ICU patients to other cities. I'll tell you one thing, if I was on the ethics committee, if you're 50 years old, in your 50s, you have double the death rate as if someone in their 40s. And it doubles every decade. 73% of the people that died in Italy in the first wave were over 80. In the first wave, 40% of the people that died were in nursing homes. So at 200,000 cases a day, I'm sure this is coming up somewhere. There's 7 people on our ethics committee. And I think you have a larger problem with the people that are disabled after they survive. How do they go home? Where do they go home? Do they go to a nursing home? What don't they, if they don't qualify for a nursing home, where do they go? That's difficult.
Well, this is one aspect for the consideration for the patient. On the other hand, given the shortage of equipment and personnel in the hospital now, I'm sure the healthcare providers have the same fear as everybody else, patients and others, about the unknown that's coming up for themselves. So for their family and so forth. How does this aspect, in addition to the increasing heavy load, impact them, and how do they deal with it? You're right there in the front line.
Yeah, I go to Wednesdays, I do the homeless shelter in Ukiah, where homeless people live or come by for their medical treatment. And it's a little unnerving to be in a small room with them, checking them out for problems. But I think it's harder. Dr. Evans, a friend of mine, is in Petaluma. The county just south of us has the highest incidence of anywhere in California per capita. He sees patients in the ER 2 or 3 times a week with COVID. Often they present with other problems. There was a motorcycle accident that needed to go to surgery for knee problems. He was COVID positive. Charlie wears an N95 mask the entire time he's at the ER and wishes he could find something else to do. 3 of the ER doctors quit a few months ago because they did not want to be put in that position. Kaiser Hospital banned all doctors over the age of 60 from their hospital because of the increasing risk of mortality. It's hard, but at the moment, I don't know what choices we have. But Charlie's very tired of an entire year in the ER in Petaluma.
And there's no relief in sight yet.
There's been 250,000 people die in the US so far. They think another 250,000 people will die in the next 4 to 5 months.
Wow.
There's almost 2,000 people dying every day now.
Well, I mean, maybe we're talking about political issues, but given we are the #1 nation in the world and one of the best healthcare systems in the world, how did we get here?
How do you what?
How did we get here?
From stupid political decisions and people making this a political issue. People should wear their masks. This should not be a political issue. This is the health and welfare and death of those people in your community. And not taking it seriously enough and thinking it was going to be over in 90 days was very ignorant. And now, as my father used to say, the cow is out of the barn.
Right.
I don't see that things are going to change until we have a vaccine. You have too many people. 80% of people have no symptoms. 80% of people have no symptoms. So it's very easy to spread.
Wow, that's very scary.
I got tested 2 days ago and I'm negative, but because I work in Ukiah and in Covelo, I get tested, even though I feel fine, 80% of people have no symptoms.
Wow.
I'll
So,
tell you, go ahead.
yeah, go ahead, please. Go ahead. I was going to ask you that what kind of impact will vaccine have, in your opinion, at this point? Given we have a couple, Pfizer and so forth,
Oh.
Probably available in a few months.
I think we're going to have good things. The Pfizer vaccine, though, has to be kept at negative 84 degrees Fahrenheit.
That's true, right? That's tough.
And the other one is at negative 4 degrees. So I'm very hopeful for the vaccine, but I think it will be 4 or 5 months from now before a large number of people get the vaccine, and half the people in the United States say they don't want the vaccine. If that's true, I think you will have a forest fire burning throughout the United States here and there for a long time. Just to make you feel worse, Italy has had a resurgence of symptoms, of cases, somewhat because the virus has mutated and it's more infectious now in Italy than it was 6 months ago, which also makes you worry about the vaccine. Will we have to have a COVID vaccination every year like we do a flu vaccination? I don't know. I think there's many unanswered questions.
Well, this is, I get a question from the audience. One of them is that, are those no symptoms people going to be sick later?
No.
Okay.
They carry the virus. There probably will be a danger to people for 3 weeks, maybe 2 to 3 weeks, but they resolve without ever having symptoms. They don't get sick later.
Oh, okay.
So
That's a good news, so to speak.
yes, very good news, except for spreading the virus. When there's up to 200,000 new cases a day in the United States, 2,000 deaths, and 65,000 hospitalizations. Please look at this graph again. It's an exponential growth. And I'm not sure how you're going to stop that unless you have everybody wear a mask and stay away from gatherings. What's going to happen with Thanksgiving and Christmas?
Do you think that part of after so many months of this virus spreading, and all kinds of psychological issues with people, some are very angry, some are desperate. There's jumping from there's one director jumping from his 27th floor luxury apartment in New York, things like that. So even if people don't get sick, they get sick anyway, psychologically.
There's a marked increase in other illnesses in the United States that's quite unexplained to some extent. But remember, 30% more suicide, 40% more overdose deaths. And my wife works for Fry Wine in Redwood Valley. There's been a 40% increase in alcohol consumption
Dr. Wang,
at home.
the Chinese room cannot hear you.
So my daughter has a PhD in psychology, and she told me tonight to make sure that everybody be as sociable
Okay,
as
now.
possible. To go outside with somebody, walk in the park with your mask on with someone, to try to increase your sense of well-being that way. It is very hard staying at home alone.
Okay, but there are other social issues associated with it. You know, for example, there are people that who don't wear a mask, and so now we see that, for example, somebody who say, "Well, please don't wear a mask," you know, in public, and then what happens? Some people are very mad when people do that. So that's part of this impactful, you know, psychological impact you're talking about.
It's unfortunate that it's a political issue. I don't understand how a virus became a political issue, but it is.
Yeah, we.
And I think it's very hard on the school children. I think that's a very hard disrupting thing. To, you know, if you're supposed to be in school and look at a computer screen like this for several hours, I think that's a very hard thing to do at any age, certainly small children.
That's right, and this adds the burden to the parents, right? That they might have to work, but the children are at home, for example.
I'll give you one interesting fact. Covelo, a small Native American clinic where I work, an hour and a half north of here, had an outbreak because a grandmother came from the Bay Area to a birthday party.
Okay.
She felt fine, but infected several people at the birthday party, went home and became ill. So in Covelo, where there's lots of people in every house, they have done very good, and they quarantine the entire house if somebody turns positive. The whole house can't leave for 10 days. And then they all get tested again. And they have done well because of the fear of, you know, such a small community, and they've had no positives tests in the last 3 weeks. So I'm just saying this can be done, but it needs a lot of social togetherness.
Dr. Ye, there are more questions at 8:19 p.m.
Okay, here's one. I from sorry, I disappeared from the. Yeah.
Well, I think it was the question about should schools open in California?
Yeah, right. Yeah.
The schools are trying to open December 9th in Ukiah. To me, I was the public health officer for 12 years. I would not open the schools until there was a vaccination. The children seem to tolerate it pretty well. There's been mixed messages. Some schools have opened and done well elsewhere, and other schools have had to close. I think that you have to have less than a 5% positive test rate to open your schools, and we're around that in Ukiah. But how do you feel about opening the 10,000 Buddhists school?
We are not opening. The city of 10,000 Buddha is very strict at this point. That is, if you go out, you have to come back and you quarantine for, 2 weeks. So our school is mostly online. That's what I know. And so we're at CTTP, we're pretty safe.
Well, I think you're safe there, but I think it's a good point that that this is causing a lot of suffering from the kids without them having COVID. I would have to study the issue more. I see, I'm not that smart. I've gone to the chat button. They say the schools in Asia are open and there's not an increase in infection. I think that depends on whether you have elderly grandparents at home. How old are your parents? If your parents are 20 or 30, okay, you probably can go to school and be okay because there's such a low death rate or illness rate in young people. But if you go home, you go to school and you have your 80-year-old grandparents living at home, I think that's a much higher risk because the children aren't getting sick, but they are carriers.
But so far, I think some of the Asian countries are doing pretty good, especially like Taiwan, South Korea, New Zealand.
But South Korea did everything right. Everybody got masks.
Right.
They had thousands of people doing contact testing, much like they're doing in Covelo. If you turn positive, the two nurses at the clinic test everybody that you've been around in the last week or 10 days. Everybody gets tested. And it's that testing that allows you to quarantine people and keep from spreading. And we have not had, and they had the results back the same day. If you go to the fairgrounds in Ukiah, it may be 3 or 4 days before you get your result. That a lot of exposure can happen in 3 or 4 days.
Here is another question.
At 8:19 p.m., there were questions regarding the test. What test would you recommend? And how to discharge patients who don't have anyone to take care of them?
That's a tough one.
For the most part, they're being kept in the hospital until they test negative, or they're going home to a quarantine situation. Is the most, because for the most part, the nursing homes won't take you if you're COVID positive because they're on lockdown as well. You can't go visit your relative in the nursing home. So again, with 200,000 new cases a day, I think it's going to be a difficult thing to contain now. We had our window. My hope is that there's been so many cases in the middle of America that people will change their view, because if you look at this map, it's California isn't the problem. It's the Midwest.
Is that due to the cold weather?
What?
Is that due to the cold weather?
It's the cold weather. Yes, and also, did you hear about Sturgis, South Dakota? No. Sturgis every year has tens of thousands of Harley Davidson motorcycle riders that go to Sturgis from all over the country. None of them wore masks. That was a month or two ago. They think over $1 billion worth of healthcare has been spent just on that motorcycle gathering.
I think this is the talking about the mentality of people, right? I mean, in this country, we talk about freedom, and but freedom is one thing, but hurting other people is another thing.
Freedom and stupidity shouldn't. Anyway, it's yeah, it's, and I think that that's the political issue. You can't make me wear a mask. I'm a free person. But anyway, and that's the thing. A lot of those people could be infected and they do not know it. They have no symptoms. I think that we will be having a lot more testing in California with the new White House. I think that you'll be seeing every effort to have testing, with results the next day. I think more money will go into testing, much like South Korea did. I think that, and I hope that these increased cases, people will start wearing their masks more. Certainly, if you see people in your family or your town dying, won't you consider it important to wear a mask? Won't take that. I don't know.
Well, why, I mean, that's a pretty straight answer, to me individually. But there are lots of people who doesn't want to do that. I mean,
I know. Well, I don't know that you can enforce, I don't know that there's enough police officers or whoever to enforce a mandate. And unfortunately, you see parties all the time amongst the young people because they're not sick. They're in
Right.
college, they're 30 years old. And I think that you have a big spike in patients 30 to 40 years old. Okay, I didn't know I was supposed to be watching the chat box. I'm not that smart, but okay. Some people wonder if Trump even had COVID. Okay. And he got this fancy vaccine everybody's talking about from Pfizer. He got that. He got the antibodies. He got antibodies serum. He got the Cadillac, if 3 days at the hospital. So, maybe he didn't have that serious of a case, but he got everything possible and did well. But I wonder if he had it. I know that's political, but
Yeah.
he seemed to do awfully well.
Do you think that? Yeah, go ahead.
Yeah.
Please.
And Stanford just let out a study that showed hundreds of cases in all of his pep rallies where no one's been wearing masks in those towns. It's an interesting study.
Yeah, how can people, seeing the number of cases of infection as well as the death, not say willing to wear a mask?
Okay, well, first of all, denial is not just a river in Egypt. There's a lot of people that drive drunk that don't ever think they're going to be hurt or hurt somebody else. And there's a lot of disinformation about this. If you go on the computer and the president says it's just a bad flu, look at me, I got over this, and pulls his mask off in front of everybody at the White House. See, it wasn't that big of a deal. Why is everybody so upset? So I do think that there's a lot of, depending on the position you took 6 months ago, are you going to say I'm stupid or continue what you're doing? I don't know the psychology to this. Perhaps you could help me with the psychology.
I don't know, but you know, at the beginning of the pandemic, you know, for example, if you look at different nations, they have a different response probably because of the culture and so forth. All right. I mean, in China,
Right.
you know, the volunteer rushed to Wuhan to support the frontline, you know, the doctors and nurses just from all over the country go to one place to support it. They built 2 hospitals in 10 days. That's one aspect. Now you go to Italy, that at the height of the pandemic, people serenade each other from their balcony. All right.
And what distresses me about Italy is I thought Italy did a pretty good job. They closed down the whole northern half of the country. They quit, you know, flying. You know, they did a lot more than we have, and they've had a recurrence. I don't know. It's you know, I don't know if that's a variant of the virus or whatnot. A lot of people say that people work in towns and then go home on the weekends to be with their family, especially their older relatives in the country. So there may be some social aspect of this that's made Italy more susceptible. I'm not sure.
Well, of course, once they open up, also people like to go to Italy to shop, you know, tourists.
Beautiful
So
country.
that's another aspect of it.
Right.
Whereas Asian countries, they control the inflow very strictly. You know, in Singapore, you come in, you quarantine for 2 weeks first.
Yeah, I think Hawaii was the only state that was really rigid about that. Hawaii got that way. And their tourism rate went to nothing. And that's the other aspect of this. With 25 million people unemployed in the United States, with a lot of their benefits running out next month, it's a very difficult time economically. You know, a lot of the Hispanic race that has been, and the African-American race that have been infected with this is because they cannot work at home. Their job is not on a computer.
Right.
They're frontline workers that you see at the gas station or the grocery store or, you know, whatever. It's difficult. I think 2 things. I would wear a mask. The social distancing is good. Personally, this is just my viewpoint. I don't think people get a lot of it by putting their hands on a desk or coming along and using the gas pump or going to the grocery store. If that was true, I would think that you'd have a lot more people infected, just a lot more people infected. There's only 1 grocery store in Covelo and 2 gas stations. If you could easily pick this up from touching things, I think that it would be much more widespread. So I think it's masks that are most important. And if you're 6 feet away from somebody, that's important, but the virus can linger in the air. So I think masks are the thing to do. It also, they think the mortality rate is less now because you're getting less of a viral burden from the masks, which I think is important. As far as recovering from COVID-19, the antibody protection does wear off after a few months. And there is somebody that's been shown in Mendocino County to have caught the virus a second time. That may be a rare case, but yes, apparently you can catch COVID more than once. I hope that's a rare situation. And again, when can we get a vaccine? And will it work? Will it work well? And how many people will take it?
That probably won't be available until early next year, right?
I would think so, not to the general public. I can see them trying to get the hospital personnel to take it, but I don't know. And the other thing that is concerning to me locally is, a couple of months ago, there was only one ICU bed open in the county of Sonoma for anybody
Wow.
because they were so overwhelmed. And I just hope that the West Coast keeps calm, because this disrupts everything. It is, if you're having a heart attack, where are you going to go? Now, the ethics of that is fascinating.
Right.
You're having a heart attack. I'm sorry, the ICU is full of COVID patients.
Even now, people are, trying to find hospital nearby, right? Rather than many of these cities hospitals.
Yeah,
overwhelmed.
I think Ukiah is pretty much the COVID hospital. I think anybody in the county that gets ill will be sent to Ukiah, rather than trying to take care of these patients who are very difficult at the other two hospitals. The United States has 3.3 beds per 1,000 hospital beds. There's 3.3 hospital beds for every 1,000 people. There's 5 states that have 5 beds per every 1,000 people. Mendocino County only has 1.1 bed for every 1,000 people. So this is a very difficult situation if there was another big wave happening here. I have no idea how they dealt with New Orleans or what they're doing in Michigan or Iowa or the Dakotas right now. And I don't know what to expect of the nurses and doctors after this many months.
Well, what will happen now? The flu season is coming.
When this first broke out, I said, what about the winter? In 1918, there was 250,000 people died in the spring. Nobody died in the summer. 500,000 people died in the winter.
That's pretty grim.
My hope is that if everybody wears masks, we won't have a bad flu season. I do think everybody should get their flu vaccine. I got my shot. You don't want to get both of these at the same time.
You think that we haven't got the COVID vaccine yet? You think we'll have some side effects?
Do I think what?
The vaccine, the new vaccine that's coming out, will have side effects for some time.
Yes, from what I've read, you feel like you're hungover for 2 or 3 days, and some of them need 2 doses. So I think there probably should be some sort of mandatory vaccination if you want to go back to work. You can't have half the people vaccinated. That isn't going to solve the problem. I would argue that there should be some sort of mandatory vaccination. Like the hospital, 90% of the people in the hospital are vaccinated with the flu vaccine. You have to have it unless you have some sort of specific problem.
Now, as a medical specialist, you probably recommend, if you were to say the new president, right? What would you recommend? What would be your?
I would somehow recommend that you couldn't come to work unless you wore a mask. You couldn't come into indoor facilities, like the grocery store, without wearing a mask. I would try to ban all parties of more than 10 or 20 people. If you look at the hard thing is, if you look at the people that get infected, Dr. Lovato is the head of the EMTs, the ambulances for Mendocino and Napa County, Mendocino, Sonoma, and Napa County. None of the EMT people on the ambulances have gotten the virus apparently from work. It's all when they went to a wedding or a party or a restaurant. Apparently restaurants are an issue. I hate to say that, but it's, I was surprised about the ambulance drivers. He said none of the ambulance people are getting infected from their job because they're wearing their masks and being careful, but then they go to a party with friends and they get into trouble.
Well, that's interesting because if they are professional, they take care of themselves by wearing a mask, and why would they not wear a mask going to party? I mean, they know the risk, right?
You're talking to an ER doctor. I can, every day I wondered, what was this person thinking?
Uh,
Yes, you would think that the ambulance people would be very good about this. Having said that, if I was an ambulance person and I was having to deal with this every day, I don't know that I wouldn't say I'm going to go to a party and enjoy myself. It's hard to be, the longer this goes on, the harder it is to be, here comes winter. You can't go take a walk in the park and have nice weather lots of the time now. So I think that, I don't know, it's the people who accounts for the severity of the 19, I think one is amount, how much viral load did you get? How infected were you when you started? But then there's no question that diabetes and obesity are the two biggest factors. And the third, even more than that, is your age, diabetes, and obesity. And I think that the African-American Hispanic population are those people that are out there frontline working, and they probably have households that have more people in them. It is easily spread amongst household members.
so I guess I think I've asked you the side effects of the vaccine, and but in any event, with our cases surging like that, we have no choice but to try the vaccine route, right?
If Dr. Fauci says the vaccine's good, I'm taking the vaccine. No question. I think also the hard thing about this is that not everybody has a cough and fever. A lot of people feel like they had the flu. This is a problem. I go out into the parking lot to see people in Covelo. We don't bring them into the clinic. I examine them in their cars, trying to decide whether they should be tested or not, okay? But the problem is that some people only have diarrhea and vomiting. They don't have any respiratory problems. Other people just have sore throat and think they had the flu. And this last week that I worked in Covelo, what's happening, people are getting the flu. How many people are you going to test that have a sore throat? How much, it's a very, think of all the people that are going to be having flu symptoms that'll need to be tested. It's a very difficult, I took care of lots of AIDS patients in the 80s. I had 3 or 4 dozen people patients die that I was taking care of. But it was a very clear-cut risk factors, and that's just not the situation now.
So moving forward, let's see.
Yeah.
This is question, how effective?
I think it picks out the sick people but it's pretty useless for 4 out of 5 people. 80% of people don't have symptoms. So I think it's good that they're screening people for fever, but I don't know how effective that is in saying that you're safe. I haven't seen a study on that.
Well, as an individual, that there seems to be, if for the sake of the society, when I see somebody that doesn't wear a mask, so I would suggest, wear one or offer one. But I don't even dare now, given the so many incidents that's happening. That if I offer somebody a mask or suggesting I might get hit, or
Yeah, you're being offensive.
Yeah.
I think this, unfortunately, well, be as good as you can, but I'll tell you, just going into the grocery store, knowing that this can be aerosolized, there's going to be risks anywhere you go. Your happy birthday sign. Who came to your birthday party? Did they all wear masks? Did anybody hug you? It's a very maddening disease.
Now the question is, given all those conditions, right? The looks like here. Well, from Carol, that according to the news today, not wearing a mask is impolite or something like that.
I think it is. I wear a mask every time I go out, every store I go in. I wash my hands. I think the mask is the most important thing, and I don't know how you're going to get around that. And if anything has been proven, masks are important. I don't know. Now, I realized they weren't sure about when they first came out, that there weren't going to be enough masks for healthcare workers. But there ought to be, a lot of individual people are selling masks on the web. And I think also you have to be aware of who you're around. It's unsettling that there's this many people that are asymptomatic.
Well, with the vaccine coming out, do you think that by next summer that we'll be pretty much out of the
Yes.
trouble?
I hope next summer we will have some sort of, enough people have been exposed or vaccinated that the rates will be dropped to nothing. I don't think it'll go away completely. And that's what I think might be difficult. If you have a marked drop off, when do you stop wearing masks? I don't know.
Right.
But I hope with some vaccines, we'll have some really good news, and things will be much different in the spring. I listened to Dr. Fauci. Dr. Fauci seems optimistic that 4 to 6 months from now, things will be very different.
Well, that sounds very good. But in the meantime, though, that from the perspective, psychological conditions of people, I wonder that we still have 4 to 6 months to go before the infection rate goes down. What is your advice for the general public in terms of self-control and become more peaceful?
That people come home and be more peaceful?
No, I mean, your advice, right? because psychologically, even though we don't get the symptom or we don't get the COVID, we are agitated.
Yes. Yes. I think, I think if everybody that was infectious was coughing, I think all those people would be wearing masks. But I think it's just so many young people, especially. It's hard not to be sociable when you're young. You can stay at home and drink your wine when you're our age. I think that the important thing for health professionals is just to thank them for doing their work. I think the more you can just give them your gratitude for working in the ICU or ER or, whatever, the hospital, the nursing homes, their pressing needs are socialization. So I would ask, can I go for a walk with you outside or do something to make their life easier? Because I'm glad I'm not in the ER full time. It's enough for the homeless shelter in Covelo for me. Yeah, the best way to thank the healthcare workers is not to get sick. That is a good line. Because the other thing, once you get ill and then the ICU, you don't get over this easily. You stay on a ventilators for for days, if not weeks. This isn't an easy disease to get over if you get sick from it.
Well, our time is up, and
and I don't think the flying on the airlines is so hard. They have HEPA filters, and everybody wear your mask or wear your mask and a shield. But I don't know about a nanosilver, but N95 masks are very good. That's what Charlie wears in the ER, and that's what most people do.
Well, I appreciate very much.
It went by very quick. I hope that was informative. I hope I wasn't too dark.
Oh, this is fascinating from your point of view on the front line. Also, my deep appreciation for Dr. Kenbing Wang for doing the translation, because being another doctor, it's much easier to do the translation.
Yeah. And I want you to know that Dr. Wang is a phenomenal hematologist, oncologist. Most people see 2,500 people a year, and he saw 4,500 last year.
My goodness.
Impressive.
And I want to thank both of you as well as to all the audience. And the next week, we have a good follow-up to this one. Professor Claire Brown from UC Berkeley, who famous economist who wrote a book called Buddhist Economics. But her talk will not be on Buddhist economics per se, and her talk will be on what's the meaning of life now given the pandemic, and that will be a very, very interesting exchange.
I had her on my radio show. She was very interesting.
Right, I remember that. Right.
Okay. Thank you.
Thank you very much.
Yeah, Ray next week is is not Professor Brown. It's Dr. Wang, Chen-Ling Wang. I can show the schedule.
Sorry, the week after, right? Yeah. I mean the next one. Yeah. Thank you.
Let me show the schedule. So
and we're treating the disease much better in the hospitals than we were. There's a lot more medications. It's that we're doing better. Okay, bye.
Thank you very much.
Okay, thank you. Bye.
Bye-bye. Thank you.
The next week, this is Nippon, will be 2 weeks from today. Then 3 weeks after, and from today is Professor Brown, okay?
Oh, I see.
It's different. And next week is going to be Dr. Chen-Ling Wang. It's going to follow this talk actually, because he's going to talk about the update. on the COVID-19. So it'll be the same time, and even though it may not be a part of the forum, but it's in line with us.
Yeah, similar. That's great.
So there'll be that, and so we'll dedicate merit. How about that? 那我们就是回向。Let's chant this in English. Merit from the strength of all the Buddhas, repay the kindness from above and rest on those in heaven below. May all see or hear others resolve power
Awakening.
and when the body is ascend, we born together in the land of bliss. Let's say bows. In respect to the Venerable Master, with the world.
Amitabha. Thank you, Dharma Master.
Thank you, Ray, for your organizing that. Also, the exchange idea with Dr. Charter was very interesting today in
Yeah.
this conversation.
Well, thanks for reminding me. I forgot the date.
Okay. Good night, everyone.
Thank you. Good night.